Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, obesity and pregnancy. And joining me now is Dr. Laura Bibb, OB/GYN with the Ruck Clinic. And Dr. Bishop, thank you so much for joining us.
Thank you.
Now let's talk about this subject of obesity. How is obesity defined?
Obesity technically is defined as being over 30% over the ideal body weight. And this is usually measured by something called the body mass index, or BMI, which takes into account a woman's height and her weight. And they have found that the lowest mortality or chance of dying related to weight in women is if they have a BMI between 21 and 25. Over 25 is considered overweight, and then over 30 is considered actually obese.
I see. All right. Now, how common is obesity during pregnancy?
During pregnancy, it is only about 8–9% of pregnancies. What can happen during pregnancy is, or in trying to get pregnant, many times overweight women have some imbalances in some of their hormones. So sometimes they have a hard time getting pregnant. So although the American population, about 1/3 or 67 million Americans are considered obese, only about 8 or 9% of pregnancies does this occur.
And what kind of complications does this create for mother and baby?
Well, for mother, a lot of times before pregnancy, she can have medical complications. High blood pressure and diabetes are the most common, and this can translate into more problems during pregnancy, such as preeclampsia. She also has an increased rate of having C-sections and also infections after the baby's born. With the baby, we worry about the baby growing to be too big, something called macrosomia, and this can lead to difficulties with delivery where the shoulder can get stuck. The babies sometimes have a higher chance of having birth defects, and we have a more difficult time diagnosing those during pregnancy because the ultrasounds technically can be more difficult to do.
So what can a person do to prevent this?
Ideally, it would start before pregnancy. So ideally, women would work on losing weight before pregnancy, cutting back on the calories in their diet, getting exercise, even getting out and walking as the weather is so pretty right now. In extreme cases, there is also bariatric surgery that is available if people are with a BMI over 40 or over 35 and have the high blood pressure. But ideally, they'd work before pregnancy, and then we limit how much weight they gain during pregnancy.
So diet and exercise are mantra before, during, and after pregnancy.
Hard
and always.
work, yes, yes.
Right. Dr. Laura Bishop, thank you so much for being with us here on Smart Medicine.
Thank you.